Hello, I'm Dr. Lita Sachs, and welcome to this video on BioAnt Talks about my research entitled Bridging the Gap in Paleopathology, Inconsistent Identification of Sutural Traits in Anthropology and Medicine. Although this presentation is about paleopathology, no photographs of human remains will be shown. In my research, I examine non-metric skeletal traits that are commonly assessed in biological anthropology. Although these traits are predominantly viewed as normal variants in anthropology, they can also have pathological manifestations indicative of complex underlying medical conditions. These manifestations are fully acknowledged in medicine. However, inconsistent identification and classification of these traits across anthropology and medicine precludes their diagnostic use in paleopathology. This talk applies medical perspectives about sutural bones to paleopathology, providing a guide for anthropologists to differentiate sutural bones that are normal variants from those that are indicative of underlying pathology. Sutural bones are extra bones that occur in cranial sutures. They are also referred to as wormian bones, intersutural bones or ossicles, intercalary bones or ossicles, and supernumerary bones or ossicles. The most commonly used term in the literature is wormian bone, named after anatomist Olaus Wormius, who described such bones in a letter to Thomas Bartholin in 1643. I will use the term sutural bone in this video because descriptive terminology is now preferred in the anatomical sciences, and also to acknowledge that Olaus Wormius was not, in fact, the first or the most notable person to describe this trait. Sutural bones are an incredibly common trait, occurring in roughly half of all adults, according to studies of dry skulls. They are described by their location, either by the suture they occupy or the cranial landmark where they are located. Sutural bones are most commonly found in the lambdoidal suture and at lambda and asterion, and least commonly found in the coronal and sagittal sutures and at bregma. Sutural bones most commonly occur as normal skeletal variants that go unnoticed or are noted as incidental findings. However, some sutural bones are pathological and are indicative of underlying congenital or developmental conditions. This radiograph, for instance, shows a number of sutural bones within the lambdoid suture in an individual with cleidocranial dysostosis. Sutural bones are therefore of diagnostic significance in both medicine and paleopathology. However, there are substantial inconsistencies in the notation of sutural bones in anthropology and medicine that inhibit their utility in paleopathology. In biological anthropology, sutural bones are almost exclusively considered a normal variant. Historically, they have been noted in passing as an incidental finding or discussed in problematic studies of non-metric traits across people of different ancestries. Other studies have investigated the etiology of sutural bones in relation to artificial cranial deformation. However, virtually no papers have acknowledged the potentially pathological nature of some sutural bones. In medicine, there is a clear distinction between pathological and non-pathological sutural bones. Non-pathological sutural bones are sometimes identified in medicine as incidental findings on cranial radiographs, but are asymptomatic and not associated with any complex conditions. Such was the case with this radiograph, where several bones in the lambdoid suture were discovered when visualizing a fracture of the parietal bone. Sutural bones that occupy fontanelles in young children can be palpated during any standard medical examination. These bones are considered pathological due to their frequent involvement in anomalous closure of the sutures and fontanelles. Other pathological sutural bones, including those that are present in high numbers or are excessively large, are often discovered during cranial visualization and used to aid in the diagnosis of congenital or developmental conditions. What follows is a guide to aid in the identification of diagnostically important sutural bones in anthropological contexts. The first inconsistency between anthropology and medicine is the distinction between true and false sutural bones. This distinction is based on the etiology of specific islands of bone. A true sutural bone is due to the presence of an extra center of ossification in the skull that develops in utero. Because they are due to separate ossification centers, these bones are discernible both endocranially and ectocranially, rather than just on one aspect of the skull. There are two different types of false sutural bones that are often erroneously treated as true sutural bones in biological anthropology. The first are very small portions of bone found along sutures that appear separated from their larger associated bone, often either endocranially or ectocranially, but not often both. These separations are due to complex interdigitating sutures, especially the lambdoid suture, that can cause small islands of bone to appear separate within the suture. The second type of false sutural bone is formed from retention of a cranial suture rather than the presence of an extra center of ossification. It can be difficult to identify these false sutural bones as they are often associated with sutures between ossification centers that close very early in development. Osteologists who are not trained in embryology may struggle to identify these bones. The most frequently incorrectly classified false sutural bone of this type is the so-called Inca bone, sometimes also called an interparietal bone. This large triangular bone constitutes the superior squamous portion of the occipital bone and is in fact the result of a retained transverse occipital suture rather than an additional ossification center. The second inconsistency in the description of sutural bones is the precise meaning of the phrases multiple sutural bones or multiple Wormian bones. In anthropology, this phrase simply refers to the presence of more than one sutural bone in a single skull. In medicine, however, this phrase may take one of two meanings, both of which have diagnostic implications. The first medical meaning of multiple sutural bones is the presence of 10 or more sutural bones in a single patient. Although sutural bones are found in roughly half of all adults, closer to 10% of adults exhibit 10 or more sutural bones. The determination of pathology in these cases relies on the size of the bones, with 10 or more sutural bones larger than 4 millimeters by 6 millimeters, indicating underlying pathology. Multiple sutural bones may also refer to a mosaic type pattern in which a large number of sutural bones occupy the occipital region. Mosaic type sutural bones are practically always pathological. Researchers have argued for alternate terms for this manifestation of sutural bones to differentiate it from simply having 10 or more sutural bones, including dysplastic sutural bones or significant sutural bones. However, the medical literature continues to use the term multiple sutural bones, or sometimes simply Wormian bones or sutural bones, to denote this pathological pattern. A third distinction that is crucial to identifying pathological sutural bones in paleopathology is that between Bregmatic and Fontanellar bones. Bregmatic bones are sutural bones located at bregma, the intersection of the coronal and sagittal sutures. Sutural bones at bregma are incredibly rare, but are a normal variant when found in isolation. However, they can be pathological when found in association with other sutural traits. Some sutural bones at bregma are classified as Fontanellar bones. These are large and rhomboidal, consistent with the size and shape of the anterior fontanelle. When found in isolation, Fontanellar bones are associated with premature closure of the anterior fontanelle, making them a medically relevant finding. Both Bregmatic and Fontanellar bones are most likely to be indicative of underlying pathology when they are accompanied by an extra bone in the coronal suture and or a retained metopic suture. Specifically, such traits are associated with early or delayed closure of the anterior fontanelle. I have the following recommendations for the recording of sutural bones in paleopathology so as to adequately differentiate between pathological and non-pathological bones. These recommendations are based on the classification of sutural bones in the medical sciences. Firstly, paleopathologists must take care to only record true sutural bones. Many anthropology papers continue to quantify Inca bones and islands of bone in interdigitated sutures as sutural bones. When true sutural bones are found, their number, side, shape, size, and location must always be noted to allow for both assessment of pathology and subsequent differential diagnosis. Underlying pathology is indicated in cases where a skull is observed to have 10 or more true sutural bones exceeding 4 millimeters by 6 millimeters in size, a mosaic type pattern of sutural bones occupying the occiput, a Bregmatic bone with metopism and/or a coronal suture, a Fontanellar bone, or any combination therein. Such cases should proceed with differential diagnosis in an attempt to determine the given condition. When generating a list of conditions for the differential diagnosis, keep in mind that 10 or more sutural bones or sutural bones in a mosaic type pattern will likely be noted as multiple Wormian bones or simply Wormian bones in the medical literature. Conditions associated with Bregmatic or Fontanellar bones will most easily be found by searching for early or delayed closure of the anterior fontanelle. Shown here is an incomplete list of congenital and developmental conditions associated with sutural bones and delayed closure of the anterior fontanelle. This list was generated by consulting a single medical reference book and compiling conditions in which sutural traits occur frequently with at least 200 reported cases. This list is far from exhaustive, but illustrates the number of conditions associated with skeletal traits that can be considered in a paleopathological differential diagnosis. Reconsideration of the potential pathological nature of skeletal traits considered normal variants in biological anthropology is extremely important. Contextualizing traits such as sutural bones within medicine allows for more widespread diagnosis of congenital and developmental conditions that are severely underrepresented in paleopathology. My eventual hope is to compile a comprehensive guide for osteologists that examines under what circumstances a myriad of common non-metric traits, including sutural bones, supernumerary teeth, and vertebral segmentation errors, can be of use in the diagnosis of medical conditions. Thank you for watching this talk. If you'd like more information on the sources that I cited, you can find that here.